It's tough to get into a Social Security office, and sometimes even if your claim isn't technically denied, you're not able to get access to it. So that is, for all intents and purposes, a denial. So we're going to teach you all the tips, tricks, and secrets of how to make sure you get the money you paid into all those decades. In FICA, how to fight the system, how to fight an appeal, and all the rest of it. This is also a live, you can tell it's live. This is a live Q&A as well. I already got tons of questions up there, so I'm going to try to go through today's topic as quickly as possible, and that way I can get to as many specific questions as I can. Okay, so let's go through the list here, and let's see here. This is live, isn't it? Yes, it is live. Okay. So denied claims and denied access. One thing, since this is getting towards the end of March here, I want a public service announcement. Doge, who is in charge of Social Security now, has changed policies. They changed it and they changed it back, and they changed it and they changed it back, and everybody out there is freaking out and stressed and worried of is their check going to come in April? Do they have to go down the Social Security Administration? No, you do not. If you're currently receiving Social Security benefits, you do not need to go down the Social Security Administration. You do not need to call. You do not need to stress. You don't need to do anything. Just go on with your life. If you're filing a new claim, this is another change. They changed it and they changed it again. So this is the updated information as of 3:02 p.m. West Coast time, March 28th. I can't tell you what's going to happen at 3:03 p.m., but 3:02 p.m., here's the situation with Doge and Social Security. If you're filing a new claim, the only time you'll have to go down to Social Security Administration, if you can't file online, if you can do things online, then you're good across the board. But if you have a phone appointment and you're filing a new claim for retirement benefits, and Social Security considers retirement benefits as retirement benefits, spouse benefits, divorced spouse benefits, and surviving spouse benefits, that's considered a retirement claim too. I think they're going to probably at about 3:04 p.m., they're going to change that last one, so those people don't have to go down to the local Social Security office. But the other two or three categories, you will. Again, if you're going to be doing a phone appointment, and the Social Security employee, when they do the phone appointment, they will tell you what the policy is at that particular time, because it changes every day. They will tell you at that particular time, okay, in your particular case, now you have to come down. In your particular case, now you do not have to come down. So just pretty much just wait for a Social Security employee to tell you when you're filing your new claim. Again, if please share and like and subscribe and all that kind of information, and get this information out there to as many people, because it's going to be a nightmare in April when 70 million people go down to their local Social Security office. So tell everybody that if you're currently receiving benefits, tell them not to worry. They're done. They don't need to do anything. The only other change, which I think is a pretty good change, is the direct deposit. If you need to change your direct deposit, then if you can do it online, then you're good. Yep, no issues whatsoever. But if you can't do it online, previously you could call and they could ID you over the phone, and then you could change your direct deposit. But there was a lot of stolen, information out there, and relatives were changing, spouses and boyfriends and girlfriends, and so there was a lot of fraud there. So they decided to, if you can't do it online, you have to go down to the local Social Security office if your office is still open at that time, and change your direct deposit directly in person. So I think that's actually a pretty good one. Unfortunately, that there's a lot of people out there that can't get to a local Social Security office, so that's going to be difficult for them. Hopefully, they make some type of arrangement for exceptions, for people that are homebound or disabled or whatever the case may be. So look out for that change of policy, probably at about 3:06 p.m. So, all right, it's a daily thing. So make sure you subscribe here. I'm going to keep you updated on all the changes, all the interesting stuff. It's not very interesting. It's pretty crazy chaos, but it is what it is. Okay, so denied claims. So there's a lot of people that are denied claims. One is for lack of evidence, and I've taken hundreds of thousands of claims when I was a claim specialist at Social Security, and I think I denied one for lack of evidence. because if I tell people they need something, then they always provided it. If they didn't, they go on vacation, they get sick or whatever the case may be, then, kind of give them a break. But some claim specialists out there, particularly with the short staffing, they might get a little bit rambunctious and deny your claim, even if you told them, hey, I'm going to get my birth certificate, it's on the way. And sometimes the claim specialist gets a little bit, anyway, and they go ahead and deny your claim, or said, hey, I'm still waiting my divorce decree, and they deny your claim. Don't worry about it. It's not a big issue. It actually causes more trouble for them. So that's why they should just wait for you to get the documents. If it's going to take just a few more weeks, but if it's going to, oh yeah, I got to get it from, overseas, and it's going to take 6 months, then it's like, okay, come back in. But if it's just going to be a few days or a few weeks, just tell the person, hey, I'm still waiting on my documentation that you requested, give me another 10 days or 15 days, and they shouldn't have an issue. If they do deny your claim, it's no big deal. When you get the document, you just take it down to Social Security, you contact that person and say, hey, I got the document. They will reopen the claim and go ahead and approve it. It's no big deal at all. Simple, simple, simple. All right. Another thing that people are denied, and there's a lot of people out there walking around that are missing benefits that they really need. People call Social Security and they say, hey, I want to file for divorced spouse benefits, or even spouse benefits, current spouse benefits. And they're told, no, you don't qualify. So you're essentially denied. You're not technically denied because you didn't file a claim, but you're essentially denied because you called Social Security and they say, no, you're not qualified. Anytime someone tells you something like that on the phone, that's not an official denial. You actually have to file a claim, go through the process, and receive a decision letter in the mail. And then if the decision letter, the actual piece of paper or the electronic email that goes to your My Social Security account, says denial, you're denied for whatever reason, then that's an official denial. But someone saying, no, you can't get it. No, you can't get it. No, sorry. That means nothing, basically. So if you call up and say, hey, I want to see if I can file for spouse benefits or divorce spouse benefits, and they say, no, you're not eligible, ask them a question. Am I not eligible because, I wasn't married 10 years, or I wasn't, married to the person when they passed away, and I wasn't married, at least 9 months. And, why exactly are you saying I'm not eligible for those benefits? And if they say something like, well, because your benefit amount is not less than half of your spouse's or your divorced spouse's benefit amount. And then you can say, oh, okay, I understand that. Which basically, for spouse benefits, your benefit amount, your full benefit amount, not how much your check is, that's called your MBA, your monthly benefit amount. What you should look at, what Social Security looks at, is your PIA, your primary insurance amount. And then they look at your spouse's primary insurance amount. That's the amount you would have received if you had waited till your full retirement age. And that's the number Social Security looks at. So there's a lot of people out there walking around. So hopefully not someone but if, ask them. And that's the number they look at. And then if the Social Security employee says, no, you're not eligible because your benefit amount is not less than half of theirs, then you say, okay, all right, cool. All right, understand, no problem. But here's where people get denied. And I know there's thousands, tens of thousands of people walking around out there that are missing benefits because they were told a year ago, 2 years ago, 5 years, 10 years ago that they're not eligible for benefits on their spouse's or divorced spouse's record because of the calculation. That calculation changes when it switches to a surviving spouse claim. So since that time, if that spouse passed away, it's no longer 50%. You can get up to 100% of that person's benefit amount. So you get 100% if you wait until your full retirement age. So there's a lot of people out there that are walking around that are missing money. So please reach out to those people and say, hey, weren't you married to someone and didn't they pass away? And are you getting any money on that person's record? And they say, no, I called a few years ago and they said I was entitled to benefits on that record. And said, well, wasn't that person still out there alive and kicking at that time? Yeah. Haven't they since passed away? Yeah. 1-800-772-1213. Call that number and hopefully you can get that person some more money and they will be ever thankful for your assistance and, name their first child after you or whatever, second child or 10th child, or, take you out to dinner or something like that. Anyway. All right. Disability. This is a big one. I did a series of videos, so you can go onto my YouTube channel and Social Security Disability. I tips, tricks, and secrets, how to appeal the process, medical records, how to treat the medical records, how to how to do the whole process. So there's about 45 minutes of videos there that you can watch to help you with the disability process. So make sure you check those out. So, but super long story short on that one, if you're denied for disability benefits, you have the appeal rights. You file the first time, that's called an initial claim. And then if you're denied, you file a 561, a request for reconsideration. And then another employee will look at it and confirm whether the first employee made a right decision. Okay. If you're denied there, then you can go to administrative law judge. And that's an actual judge. Unfortunately, it takes forever and a day to get to see a judge. But if they reverse the initial decisions, then you will get all that back pay. If you're denied there, then there's called the appeals council. And if you're denied there, you can actually file a federal lawsuit. One thing about denials, Social Security employees should do a better job at this, telling people when they file for disability benefits that when you file for disability benefits, Social Security employees always address both programs. What does that mean? Social Security offices, they have people that take care of Title II and then Title 16 of the Social Security Act. I was a Title II claim specialist. That is SSDI, Retirement Survivor Benefits, Spouse Benefits, Medicare. So SSDI benefits is under Title II. And then when you're filing your new claim, they will also see if you're eligible for SSI, Title 16. That's the welfare-based program. And they will ask you about income and resources and stuff like that. And if you don't want to file for the welfare-based program, or you've got money in the bank, or you're going to make more money on SSDI, or if you're married and your spouse is working, whatever the case may be, you're not eligible for the survivor benefit, or excuse me, the welfare-based benefits, then they will, the computer automatically generates a letter, and then you receive that letter that you've been denied for SSI. And people always freak out because Social Security employees should say, hey, we're going to work on your SSDI disability application, but just kind of FYI, you're not eligible for the welfare part, and you're going to receive a letter. It's going to say you're denied. That's not this. That's just the welfare part. So Social Security employees, they're so inundated now out there. So they're barely able to keep up. So if you get that letter and it says supplemental security income on the top, don't worry about it. That's something completely different. If you think you're eligible for SSI, the welfare-based benefit, then contact them and say, no, I want that. And they'll double check to see if you're eligible for that. Okay, Medicare. Medicare, you're denied if you apply at the wrong time. Like right now is the general enrollment period. From January, February, March, anybody can go ahead and sign up for Medicare, Part A, Part B, during the general enrollment period. If you are a year or 2 years late, then unfortunately you're going to get a penalty. The Part B penalty is 10% for every 12 months you did not have Part B when you were supposed to. So if you're now signing up at 67 years old, you're going to have a 20% penalty. 20% of what? 20% of the $185. But now you can do it. You can sign up for Part B and pay the penalty until March 31st. And then starting April, you can't sign up again. You'll have to wait till next year, the next general enrollment period. But if you're 65 years old, there's 11,000 people that are turning 65 every single day, baby boomers. So if you're 65, you can go ahead and sign up. I would recommend now about 3 months before you're 65, go ahead and sign up. If you're currently receiving Social Security benefits, you don't need to sign up. It's automatic. They automatically send you your Medicare card in the mail about 100 days before you turn 65. If you're currently receiving Social Security benefits. If you're not, then you manually have to actually sign up for Medicare Part A, Part B, if you want it. It's mandatory, but it's not mandatory. It's mandatory if you do not have creditable coverage. That means health insurance from current work. yours or your spouse's, and your employer has 20 or more employees. If you have that, then you don't need to contact Social Security. You don't need to sign up. You just go on with your life. If you have that and then you receive that card in the mail, then you definitely need to reach out to Social Security and say, hey, don't charge me $185. I already have health insurance from work. And this is also the not only the general enrollment period for Medicare Part A and Part B, this is also called the OEP, the open enrollment period for Medicare Advantage and getting out of a Medicare Advantage plan. So up until March 31st, if you have a Medicare Advantage plan and you forgot to check it, for this year, or you lost a doctor and maybe you want to switch, or you found out this is not the one you like and you want to switch and want to confirm whether you're still in the best plan, you can reach out to chapter there and they can review your plan with you and see if you're in the best plan, see if there's any other better options. 100% free. They sponsor my live Q&A, which I will start here in a little bit. And this is also the time up until March 31st that you can get out of a Medicare Advantage plan, go back to original Medicare and get a Medicare supplement plan. You probably will have to go through health underwriting depending on your state. And health underwriting is, not a physical or anything. They just ask you a few dozen questions. And if you answer no to most of them, then you're probably good. But you can reach out and see if a Medicare supplement, which are the ones I always recommend, a Medicare supplement plan N or a plan G. But if it's not right for you, you can't get into it for whatever reason, then at the very least, check out your Medicare Advantage plan because, you're stuck with it until December 31st. January 1st, you can go into another one, but unless you move or something like that. So if you move, there's some exceptions where you can change your Medicare Advantage plan after March 31st. But you can reach out to chapter. Those when Dr. Oz comes in and he's in charge of all of that. So we'll see all kinds of changes. So I'm keeping an eye on that one as well to keep you all updated. All right. Independently entitled divorced spouse. I always like to mention one of these, almost at least once or twice a week when I do these lives. Independently entitled divorced spouse benefits. There's so many people. I tell people about this and they go into the local Social Security office and the people at the front windows says, no, there's no such thing. Dr. Ed doesn't know what the heck he's talking about. And then they come back to me and they come to live Q&A and say, Ed, you're an idiot. Usually my wife that says that, but anyway, but other people say it too. I went in there and they said, I can't do that. So I have to send them the policy in, the PALMS policy, which Social Security has. And then they go back to the office and the person looks kind of sheepish and they go to the back and they come back again after 5 or 10 minutes and they go, oh, I guess you can. So it's basically independently entitled divorce spouse benefits is if you're married to someone for at least 10 years, divorce situation, and you're currently receiving benefits on your own record, so at least 62, you can file for benefits on their record, even if they haven't filed for benefits. That's the independently entitled part. Even if they haven't filed for benefits, your divorced spouse, as long as they're 62 years old and you've been divorced from that person for 2 years, you can file for benefits on that person's record. That 2-year divorce thing, it's only for the independently entitled divorced spouse benefits, not for any type of other. If your ex is currently receiving benefits, that 2 years thing is not relevant. So there's lots of people out there that are walking around and because they were told, no, you have to wait till your ex files for benefits. Not true. So, all right. So access. People are being denied every day because they can't get into the phones. That's essentially a denial of your claim, denial of your benefits. So there's a bunch of tricks that the regular viewers to my channel know and that they are sharing with their friends and family that you call Social Security, you log it down, you write it down, you take a screenshot. People are saying, texted me and say, well, what the heck's a screenshot? It's, or you take your phone, if you got a little iPhone or Android or whatever, and you push a couple of buttons and it takes a picture of your phone screen. Anyway, or you take out an old camera and take a picture of it or something like that. Or you get your phone bill, whatever the case may be. What you need is some type of proof that, yes, when you do eventually get your appointment at Social Security a month or 2 months down the road, you don't lose those months. So 2 months later, when you actually get to talk to a human being, then you say, see this? I called you guys 2 months ago, and I know Doge is firing y'all. And so, and Social Security has been a 50-year low in terms of staffing for a long time. And now it's, 10 times worse. But anyway, I called you all 2 months ago, and they say, oh, okay. All right. We will use that as a protective filing to give you 2 months of that back pay. So that is a trick that you need to make sure. And if you have to go down, there's a lot of people that, lose their job and they lose their health insurance or whatever, and they need their health insurance to start immediately. You can't wait for a month or 2 months or 3 months to get in. Go down to the local Social Security office. And if they don't let you in, the guard is usually the one. The guard is not a Social Security employee. They work for Federal Protective Services. But you just tell them this is a dire need. Call your congressperson before you go down there and tell the guard this is a congressional inquiry. I call your local newspaper or TV station, and then when you tell the guard this is a PR issue, any type of those kind of code words, Rosebud, they will let you in. All right. So you can get past the guard, they can let you in, and then you tell the person at the other side of the window says, hey, I just lost my job. I need my health insurance to start in 2 days. And they will expedite that and get you set up. But then you have to, figure out all the other parts of your Medicare and all that. So call a chapter there and they can help you out. Okay. I think we went down the list, but there's exceptions. So let's get into those exceptions right now and go through your questions. Saturday, Michael Ann. What's up, Saturday? Hello, my dad is 83. He gets Social Security. He only gets $25 in food stamps or EBT, whatever you call it. Yeah, same thing. Can you help with some advice? He can't drive, can't work, can barely get around, and I'm trying to help. I've done several videos, and you can check on my YouTube channel. It's the title of the thumbnail thing says "Living on Social Security Alone." And I go through about 50 different programs that might help him out. So, if he's getting Social Security, it depends how much he's receiving. He might be eligible for Medicaid from the state, and that'll cover all his health type stuff. But if he's already receiving food stamps, he might have already applied for the Medicaid type thing. Energy assistance, if he has Medicare and Medicaid, he might be able to get one of those Medicare Advantage plans, where you see those things advertised with the, the $100, $200, $300, grocery cards. Those do exist. They do exist. The way people try to sell those are kind of scammy, but they just might be available in your area. Chapter, you can reach out to them and they can see if there's something available in his area. Remember, March 31st is the deadline for confirming you're in the correct Medicare Advantage plan for the rest of the year. If you don't do anything, that you're stuck with it until December 31st. And then in October 15th through to December 7th, then you can check it again for 2026. But yeah, it's a good idea to get well. The getting's good. Maria, at 54 years old, when Social Security drops your disability because now you're on survivor benefits, you get a Medicare card. Does your Medi-Cal get dropped too? Okay. So Social Security drops your disability because you're in survivor benefits. No, they don't really. Yeah, at 54, if you're 54 and you're getting survivor benefits, that means you're getting disabled widows benefits. You're getting widows benefits, survivor benefits, same thing, and that's disabled. That's a disability program. So a DWIB, as they call it. Disabled widows benefits, you get that between 50 and 59. Starting 60 years old, you can get survivor benefits, widower benefits, same thing. So, but in terms of Medi-Cal, sounds like you're in California because that's California. That's what they call Medicaid is Medi-Cal. It really depends on how much your survivor benefits. So a lot of people don't know this, that you can get disability benefits and spouse benefits on top of it. Disability benefits and divorce spouse on top of it. Disability benefits and independently entitled divorce spouse benefits on top of it. Disability benefits and survivor spouse benefits on top of it. One offsets the other, but you can get both of those. And because you have disability, your Medicare will continue. But in your particular case, Medi-Cal, Medicaid in California, it depends how much your benefits increased, how much your money coming into the house increased, because, Medi-Cal, Medicaid is a welfare-based program. So if you were making, $1,500 from disability, and now you're making, $4,000 from survivor benefits, then yeah, Medi-Cal might just kick you off. So you definitely need to reach out to them and check it out. So, Dr. Ed, this is how are you? I hope you're doing well. I'm doing outstanding. Every day above ground is a beautiful day. My husband passed away in 2020. Wow, so sorry. And I'm trying to apply for his Social Security. After I get his Social Security as a widow, I want to stop the survival benefits. Survivor benefits, same thing. Widow, same thing. It's the same thing. Yeah, it's the same thing. One thing that is different for survivor benefits versus regular spouse benefits, if you want to get spouse benefits from a current spouse or a divorced spouse that's still out there alive and kicking, you have to file for benefits on your own record first. Survivor benefits is an exception. If you want to file for survivor benefits, you don't have to file for benefits on your own record first. You can hold off, let your own benefits increase until you hit 70 years old, or vice versa. I wouldn't wait till 70 if you're waiting for survivor benefits, because the calculations just don't work. But all right. I denied my SSI disability while I was in a hospital after I had the stroke. They denied. Wow, Joseph, that's not good at all. You were in the hospital and they denied you in the hospital after you had a stroke. Yeah, hopefully you have 60 days to file an appeal after you receive the decision letter. Technically 65, they give you an extra 5 days for mailing and stuff. But if it's over the 65 days, then you can request a good cause. And I've, you know, gotten probably a few thousand good cause requests, and I've always approved them. So a good cause statement is, hey, I know I should have done it within, a couple of months. I should have appealed this decision, but, I was dealing with this and I didn't get the letter. I was moving. I was in the hospital. So sure, it's, 4 months late, but, come on, give me a break. And yeah, something like that, they usually approve it. So let's see. I do not think there was any rhyme or reason to the WEP disbursements. Me too. I completely disagree with the Social Security Fairness Act. The old WEP and the GPO calculations, they weren't perfect, but to throw the baby out the bathwater makes no sense whatsoever. Thanks, Ed. The Social Security website today makes it sound like I will not have to make an appointment. I applied for divorced survivor benefits online in January, and app is in the process. Nope, you're good, Elizabeth. Just go on with your life and wait for your check to come in direct deposit. So my application is saying 320 days to review. Can I expect longer now? Yeah. It was only 2 copies they had to review. Not sure. 320 days. That's definitely, it sounds like you are in the 3rd stage of your disability. You're waiting for the administrative law judge possibly to make a decision. So yeah. And yeah, the staff are falling like flies. They're being moved out. I'm going to talk about the interview with Doge and stuff, and they were saying, oh, they haven't fired anybody. But if you read some of the letters that people were getting, they were like, jump ship now, or it's going down. We're going to make it go down, and it's either take this, these gold coins now, 25,000 or so, and different little things. They're enticing people to move out, or you get nothing when we, do the drastic stuff later. So we didn't fire anybody. It's like, it's like Japanese samurai and Harikiri. Those were actually forced suicide. But anyway, I won't get into that. Started my Social Security at 77. Spouse to start at 70 in a month, or you start at 70. Okay. Spouse to start in 70 in a month. Apply for spousal. Will I also get my own delayed payments? Okay. So you started 70. Spouse is going to start at 70 as well. So delayed payment. So are you talking about delayed retirement credits? Yes. You're waiting till 70. So you're going to get, sounds like probably 24% above and beyond your full benefit amount. Remember, Current spouses do not get those delayed retirement credits. So that's a mistake a lot of people make. What does that mean? That means if you waited till your full retirement age and now your benefit amount is $5,000 a month, which there are now, it finally went to over $5,000 if you paid the max your entire life and you waited till 70. So if your benefit amount is $5,000 a month and then your spouse is only receiving 2,000, you're like, oh, he or she will be able to collect benefits because they're less than half. No, that's not how it works for living spouses. It still goes on the PIA, the benefit at your full retirement age, 66 and 8 months or 67 or whatever the case may be, not delayed retirement credits. A spouse does not get delayed retirement credits until they are a surviving spouse. So, what is the best way to file for disability? Do you need an attorney? I hesitate to talk bad about attorneys because they're so litigious. But if you want an attorney, go for it. But in the initial stage and the second stage, the reconsideration stage, they're just going to ask you the questions that the application or the Social Security employee will ask you over the phone, or if you do it online. I kind of prefer doing the disability claims online. Why? Because if you call the person on the other side, you have to wait 2 months, so that's going to delay you 2 months. And the person on the other side probably has, 15 appointments that day. So unfortunately, they're going to have to rush everybody, even worse now. So if you file online, then, you can do it. You can take your time. You can, put out your prescription and watch my videos on filing online. And then, you can just do everything at your own pace. So attorneys play with numbers, and they say if you use an attorney, your chance of being approved is improved by 20, 30, 40, 50%. Call an attorney and they will screen you before, and they'll ask you some questions about your disability, and a lot of those they don't take. They take ones that they think they can get approved and make money from. It's they're in it for a business. So of course they're going to have a higher approval rate than people used to come down to Social Security, and I've taken a few of these claims, and I'm sitting there and says, okay, what's your disability? I'm pregnant. Okay. For Social Security disability, your disability has to keep you from working, and that disability has to last for 12 months or longer. I'm sure in every state, maybe Florida is different, but sorry, Florida. Yeah, pregnancies don't last more than, 12 months. But the person demands it. I don't care what you say. I want to file for disability. Okay. All right. So we have to take the claim and then we deny it. So that goes into the metrics of, Social Security denies all the, disability claims. And that is a myth that we need to stop repeating, that Social Security denies everybody's case the first time. Please, please, please stop repeating that myth, because number one, it's not true. You just got to look at the stats. Someone just put that they got their claim approved the first time. And it's disheartening to those people that really need to file for disability, that, are really disabled. They're having a tough time in their life. They're worrying about their, disabilities and doctor's appointments and treatments. And now they don't have any income, and they're worrying about their future for their families. And then they hear y'all talking about, oh, they're all denied the first time. And it's just too much. So they don't file. So please, let's stop that. Seems that my SSA account has been changed. Haven't been able to take a look for a couple of days. I know, what they said, reported, the Social Security system has gone down 4 times in the last little while. And it's Social Security has been begging Congress for decades. We need to update our Social Security system, and Congress continuously refuses. So, Sandra, what's up, Sandra? They say they're going to take 100 if you got overpaid. If so, what options can someone take to survive? Yeah, 100%. Yes, that is the new DOGE policy. And they say, well, we're just going back to the old DOGE policy, or the old Social Security policy that was under the previous Trump administration and under Obama. Yes, technically, but the world has changed since then. What Sandra is talking about, if you get an overpayment, Social Security is going to withhold 100% of your check. And up until a few weeks ago, okay, what you would do is you go down to the local Social Security office or call and make an appointment or whatever and say, hey, yeah, I got overpaid. Let's make an arrangement. And you make an arrangement and you get your checks restarted minus, 5 or 10%, whatever you negotiate. But yeah, this is a different world now with Social Security because we're talking about Doge Social Security, and they've, let go thousands of employees. So you might not be able to get down there and get your benefits restarted and get negotiated for a month or 2 months. And you might just be losing a month or 2 months of benefits. And then because you're not getting those benefits, your Medicare might get canceled. And so, yeah, it's not good. I am a retired firefighter that should be part of the Fairness Act and have not received an increase this month. Social Security check or back pay for 2024. Help, please. Yeah, I told everybody when they passed that Fairness Act, the whole thing to kind of completely go through, it probably going to take about a year or so. The first ones, the ones that are already in the system to unwep your PIA, as it's called, is pretty easy-ish. But they just have to redo the computer system and, add some code for that. But Social Security, they came out and say, hey, yes, they're working on it. They've processed a few 100,000, but they said, wait till April. So if you don't get your check in April, then reach out and say, hey, what's going on? So are we sure they didn't shut down the government? Richard Quaid. Well, the acting commissioner of Social Security, a Doge guy, kind of had a temper tantrum, and he said he was going to shut it down. But then he changed his mind the next day and said he won't shut it down. So this is, Social Security has been around for 90 years. They've never missed a payment. They might, individual people, obviously, but in terms of, Social Security, millions of Social Security, they haven't missed a payment. And, Obama didn't have to bail him out like he bailed out Tesla. So yeah. Elon Musk has been around a few years. He already had to be bailed out by the government. Social Security has been around for 90 years. Yeah. So I get my Social Security last Wednesday of the month. It hasn't posted yet. I'm getting worried. Our credit union says they haven't received them yet. Where is our checks? Yeah. Normally, you just wait and it comes. But there's no telling what, someone did, one of the Doge people did on the inside. You should be okay. But I'm sorry. I have no idea what they're doing in there. Can you explain the monthly earnings test and when that may apply? Ron, yes, absolutely. So this is for retirement benefits. Again, retirement benefits, spouse benefits, survivor benefits, same type of thing. So, and it's for early retirement. So before your full retirement age. So if you're 62, 63, 64, 65, this is what we're talking about. Okay. So if you are going to start your benefits this year, let's say in July, and I always exaggerate for effect, and you're making $1 billion a month, from January, February, March, April, May, June, you made $1 billion a month. But in July, you're going to stop working, or you're going to stay under $1,950. So you can start your benefits in July, even though you've gone over the annual earnings limit, the $23,400 for the entire year, because they don't care what you made before you start your benefits. They don't care about that, $6 billion you made before you start your benefits. They only care about how much you make once you start your early retirement. So they will ask you, they will say, starting July, are you going to go under $1,950 and stay under that limit for the entire year? And you say, yes. And they said, all right, we'll start your benefits in July. And you'll say, but I already made $6 billion. Then we don't care. That's before you started your benefits. So, because you have to understand, Social Security started during the Depression and people were making money and then all of a sudden they weren't. And so, Social Security couldn't very well say, well, you made a whole bunch of money, so you can't start retirement. It's like, well, I'm not working. So, but the following year, you can't do that a second time. You can only do it, basically the first time, that first year. The next year, you have to stay under the annual earnings limit. But insider tip, trick, secret here. Sometimes the Social Security computer system doesn't recognize it, and maybe the claim specialist codes the non-service months, as it's called, they code it wrong. And then next year you'll receive an overpayment letter, and it'll say, hey, you said you were going to be, earn under this, and you made $6 billion. You owe us all that money back. And you just have to go down there and says, no, 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 no. That was before I started benefits. 90% of the time it doesn't happen. 99% of the time it doesn't happen. But if you've got an employee that doesn't code it right, then yeah. Let's see here. Oh, people having a hard time getting a hold of chapter there. Yeah, this is the end of the enrollment period. So yes, they are being slammed right now. So, but yeah, please, they will keep trying. Keep trying. I know they brought in a lot of people to help. But yeah, we've got a few more days for the end of the open enrollment period, and as I usually call Valentine's, the annual meeting of the Procrastinators Club, where all us guys go down to Walgreens at the last minute and buy chocolate and stuff. But I guess this is another annual meeting of the Procrastinators Club. Everybody waits to the last minute. So, but yeah, as long as they push the button and change your plan or get you out of Medicare Advantage by the 31st, everything will start April 1st. So yeah, we just want to make sure you get it done before then. I was just told 2 weeks ago that I was not eligible for spouse benefits because I remarried being on SSDI. Yeah, if you remarried and are currently married, then yes, you're not eligible. The only time you can be eligible for a spouse benefit is if it's a surviving spouse benefit and you remarry after, if you remarry after the age of 60. So this guy is an embarrassment to this country. He is a leftist all the way. Don't believe anything he says. Hi, Gail. Okay. All right. Well, then, bye. I was told that for migraines, I think that was my wife pretending to be Gail. I was told that for migraines, I should submit a migraine journal. My migraine journal is in a paper act note. How do I give this journal to Social Security? Yeah, just make a copy of it and don't give it to Social Security. Give it to DDS. Those are the people that are making the disability decision. So call up DDS in your state and say, hey, who's my claims examiner? Who's in charge of my case? And you should do that anyway. Call them up, because once you file for disability benefits at the local office, they check out all the technical stuff, make sure you're insured and get all your information. And then they send that whole thing up to DDS, the Disability Determination Service. And those are the ones that get all your medical type stuff and make the decision. So you should always reach out to them about a month or two after you file and say, hey, who was assigned my case? And you talk to that person. Hey, Vicky, how you doing? This is me. I'm not changing my address or anything. I just want to make sure it got up there and everything's cool and copacetic. And oh yeah, by the way, I have a little journal I've been keeping and stuff like that. I can make copies of it and send it to you. And what they'll do is they'll send you a barcode, and they'll mail you a barcode, and then you make copies of your journal and you put that barcode sheet on the top of whatever you're sending up there, and you fax it. And that way it goes right into your file. That way it won't get lost. So that is the best way to do it. So, hi, thank you so much for your hard work helping people like me. You're welcome. Today I reached Medicare Help Chapter. Jessica answered all my questions. I'm very thankful. Okay, awesome. So Domicile was able to get in there, so we appreciate it. And Chapter's doing an awesome job. And remember, with Chapter, this is the reason my son and I chose this company. We didn't want to get into this Medicare Advantage and Supplement Part D and all that stuff. We didn't want to get into there, but there were so many people that were given wrong information and pushed into something they didn't want and everything. And one of the most important things that I like about Chapter is, remember, they have a member success team. So Jessica helped you out. Perfect. You're good. Now you're signed up. Then you probably won't have to talk to Jessica again until next year and to confirm your plan is still the best one. But Chapter's still there for you. So if you get some type of weird email from your health insurance company or a bill, or you need to find a new doctor, or if they deny your prior authorization for something, or whatever the case may be, reach out to Chapter. They have a member success team. They're one of the only ones that have a really super good one like that. And they're there for you 365 days of the year. Well, that's a saying. They're not there on Sunday, except for the end of the year. But anyway, you know what I mean. So perfect. Thank you for letting me know. I get widow's benefits in Florida. Sorry, Florida. I grew up in Florida, so Homestead and Bradenton. Homestead before it was destroyed by Hurricane Andrew. But anyway, so I can harass Florida. I was filing from my retire benefits. Was told I had to take widow because it was 78 cents more than mine. Okay. Okay, that could be a case. Well, 78 cents. They kind of they round up and down. So, but it really depends how old you are. If you're like 63, if you're under your full retirement age, that might not be good advice. If you're after your full retirement age, well, even if you're 70, after 70, then that's probably correct. Okay, so I'm sorry, I'm confusing you here. With survivor benefits, you don't have to take, even if it's more. Okay, if they're saying, okay, you should take survivor benefits because it's more. Okay, that might be fine, and it's $1 more. So you're not touching your benefits on your own record, your retirement benefits on your own record. So if you're under 70 years old, that's good. Your retirement benefits on your own record will increase. So if you're getting $1 more on survivor benefits, stay with that. Don't touch yours. And then next month, you're going to get $1 more on your own. And then $5 more, and then $10 more. And then by the time you reach 67 or 68 or 70 or whatever the case, it maxes out at 70, you might get $300 or $400 more on your own. So it really depends on your age whether that is a good strategy, but it just might be. So they might have done you right. So if you receive Medicaid and Medicare, does that make you eligible for SSI, SSDI? No, not necessarily. The reverse, if you're receiving SSI, you're what's called categorically eligible for Medicaid. It means you're automatically approved for Medicaid. If you're receiving SSDI, yes, you are eligible for Medicare after being on 24 months, but not the reverse. So if you have Medicare, you already have SSDI. And if you have SSI, the reverse is true. So that's probably the best way to put it. Doctor, please remind anyone who owes back child support that they will pay child support half of back pay and up to 50% of future payments unless you work out payments for less. This is true. Social Security doesn't really get into all that stuff, child support, alimony, or anything like that. They do. They just have whatever the courts tell Social Security, garnishment wise, then Social Security has to follow it. So if you have child support or back pay or alimony or whatever the case may be, you go to court and the court sends Social Security a garnishment order, then Social Security has to abide by that. So whatever the court says, then, and people used to come down to our office all the time and they say, yeah, I just went to court and I got it changed from, $500 a month to $250 a month for child support. And here's the order. And we say, yeah, sorry, can't help you. We have to wait for that order to come directly from the court. Because guess what? People used to come down there and change court orders and stuff like that. And so, yeah. Chapter found my dad a better plan. Awesome. Thank you, Anna. Very grateful for letting me know about Chapter. I was always found the Medicare website confusing. Yes. And they're free to help you out. And again, that member success, even if, it's like, well, yeah, I don't want to deal with those people and whatever, go to Medicare.gov and do it yourself. You've lost the ability to get that, member success team to help you throughout the year. So, for no other reason than that, it's a good thing. New Social Security Director Bisignano was CEO of JP Morgan Chase, CEO of FistServe, one of the highest paid CEOs in the US, not on our side. Yeah. If you watch, regular viewers know that I said, he kind of has two hats. He's a Wall Street guy, which I don't really like having his fingers in, Social Security, but okay. But he's also kind of an efficiency guy, I guess. But it's like the old GE Jack Welch. He was an efficiency guy. How was the efficiency guy? He fired everybody and sent the jobs over to China. So, I was gonna, wait till he actually did something, but his Senate testimony was not great. So I started getting survivor benefits, and my CPA told me I can only get it till 70. Incorrect. Then I have to start using my benefits. I thought I would be on benefits for life. True or false? Hey, Delene, how you doing? Um, your I think your accountant said that because that's best for you, which I could see that. So yeah, he was saying stay on survivor benefits and then don't touch yours, and yours will increase all the way until the month you hit 70. And then when you hit 70, then switch over to benefits on your own record because it's going to be a lot more. So if that's the fact that your benefits on your own record are going to be a lot more than survivor benefits at 70, then yes, he was telling you 100% the truth. So a lot of accountants out there don't know Social Security and they give terrible advice, but he sounds like a good one. So if those numbers are right. So where does the money for an independently entitled divorced spouse come from if it doesn't affect my retirement payment? It's just like any spouse benefits. It just like everything else. You pay into FICA, and the FICA you pay into, pays for your retirement benefits. And if you've got any children under the age of 18 or became disabled, or you have a spouse or surviving spouse, whether it's current or divorced or whatever, that's where it comes from. So, and it doesn't affect your benefits. I haven't mentioned this in a while, and I think let's take this opportunity. So there's a lot of divorced spouses out there that are walking around and losing money because, number one, they see on the divorce decree that the ex-spouse or the attorney puts down there that you can't have my Social Security. You can have the dog in the car, but you can't have my Social Security. And Social Security doesn't care about that. That's no effect whatsoever on Social Security. Social Security, when you give Social Security a divorce decree to prove that 10-year marriage, the only thing the employee looks at is the names and when you were divorced. That's it. To get that at least 10-year marriage. That's it. They don't look at page 72 where it says you can't get, you signed right here, you can't get this person's Social Security. Yeah, Social Security doesn't care about that. It means nothing. So nice try, ex-spouse. But there's a lot of people out there that think it means something. It doesn't. A lawyer contacted me one time and says, well, the reason some people put it in there is they say, well, if you get Social Security, then you get less alimony. Okay, that's a whole different issue. But so that's a whole different issue. But Social Security doesn't care. All right. And number two, people out there walking around losing money are divorced spouses that don't want anything from that divorced spouse or that ex-spouse. And they say, that person was a nightmare. I don't want anything from them. Well, you're not getting anything from them. That's not from them. If you file for benefits on their record, they won't even know. It's not going to affect their benefits or their new spouse or their new kids or whoever. They won't even know. You are entitled to that benefits. You're eligible for those benefits. That person paid in a FICA. You tolerated that person for at least 10 years. So that's your money. They will never know. And sometimes I lose that battle and sometimes I don't, where they say, I don't care whether they know or but anything in connection with that person, I don't care if I'm going to make an extra $2,000 a month. Anything that's connected to that person, I don't want. And I'm like, but it's not really connected. I don't care. I don't want it. So, all right. Well, so sometimes I lose that battle. So should my spouse contact Medicare before she turns 65? Will my SSI go up when my spouse retires? Okay, SSI is welfare-based program, supplemental security income, but you mean Social Security. Okay. If your spouse is currently receiving Social Security benefits, then she does not need to do anything. At 65, about 100 days before she turns 65, they will send her Medicare card in the mail, the A and the B and everything, and they'll start taking out the $185 from your, Social Security check. And so all good. But you need to find something to cover all the gaps, Medicare supplement, Medicare Advantage, Part D, and all that stuff. Call up chapter and they can help you with that. If she isn't receiving Social Security benefits, then she does need to reach out to Social Security and sign up for Medicare at 65, a few months before she turns 65. If she doesn't have health insurance from current work. If she has health insurance from current work, yours or her own, and that employer has 20 or more employees and you're happy with it and they're not making you, your company isn't making you sign up for Part B, then you don't need Part B. Okay. Um, will your benefit go up? No, unless her benefit amount is twice your full benefit amount. If it is, then when she files and you're already receiving benefits, then yes, you can file for benefits on her record and then your benefit will go up, or vice versa, whichever one is the highest. What happens to Part B if you are getting Medicare 1026 on SSDI, and that is my onset 423, so 5 months and 2 years start date? Okay, so what happens if you get Part B? So after being on Medicare for 2 years, or excuse me, after being on disability for 2 years, that includes the 5-month waiting period, but yeah, you will get Part A and Part B, and after being on disability for 2 years, that's automatic. They will send you your card just like you're reaching 65. So, and a lot of people, make sure if you move, make sure you contact Social Security and update the address, because if you don't, a lot of people, on disability, they don't realize they get Medicare after being on disability for 2 years, and then they move or throw away, you get a lot of junk mail and they throw it away. And there's a lot of people out there that have Medicare, have health coverage that they're paying for, and they don't even know it. So, yeah. Do I need to have a ME ID account? I get SSA. I don't remember my login info for my Social Security account. I read that's going. Please help. It's always good. Always and forever. What's up? It's always good to go in there and set up a My Social Security account. In order to do it, there's a couple of ways. Kind of gatekeepers. And that's one of the gatekeepers to make sure it's actually you setting up that account. So it's tough to get in there. It's a nightmare to get in there sometimes and set up an account, but it's tough, and it's a nightmare for a good reason, to protect your information. So if you if you don't remember your ID and all that kind of stuff, then you can press that button where it says, I forgot my ID, I forgot my password. And yes, it is a nightmare. So expect it to be difficult, but it's difficult for a reason. So, how long do you have to take your own Social Security benefits before switching to current spouse benefits? We'll take mine for all in 2 years. Well, you don't switch. Current spouse, you don't switch. You just add that on top. So, how long do you have to be taking? Well, it doesn't matter. You can take your benefits for one day, and then, on the same day you file for benefits on your record, you can file for spouse benefits, but they have to be receiving benefits. So you can't file for spouse benefits unless that spouse is currently receiving benefits. We're talking about a current spouse. That's a current spouse. If we're talking about a divorced spouse, that's different. So, doctor, if you get disability benefits, is there any way to get cheap life insurance? Oh, yeah. Yeah, not there yet. Yeah, just reach out to someplace. I couldn't help you with that. I'm thinking about, maybe adding that in future, but not the now. I have disability and I'm about to turn 65. Do I need to do anything? Okay. Common question all the time. If you are 65 on disability, you probably have a Medicare Advantage plan, because that's the only thing you can get in your state. Maybe you wanted a Medicare supplement plan, but in most states you can't get it having Medicare under 65. That's state laws, state regulations. So now that you're 65, you can get whatever you want, and they can't deny you for a Medicare supplement. They can't ask you health questions. So when you're turning 65 on disability, check to see if a Medicare supplement plan is better than what you have a Medicare Advantage. No prior authorizations, no networks. There is a monthly premium for those. But yeah, you can reach out to Chapter and, a couple of 3 months before you turn 65 and say, hey, what is a plan N and what is a plan G and what's better? How much does it cost? And why is that better than my current Medicare Advantage and stuff? And because this is probably the only time you're going to get to switch to a Medicare supplement. So it might be a good idea to get while the getting's good. All right. I got tons of questions, unfortunately, as always. I can't get to them all, so let me randomly grab one here. I was approved within 5 weeks. That's Bella Italiana. That's anytime anybody says that, I'm like, that's great, but that's also terrible. I'm great. It's great that Social Security, was able to identify your disability, but it's terrible that, you know, that is a priority case. And yeah, I'm sorry about that. The cancer diagnosis was on the compassion allowance listing for SSDI. I would rather have my health back any day. Exactly. Yeah. So, yeah, that's why I say it's bittersweet. Congratulations on getting approved and getting rid of, jumping over that bureaucratic nightmare. But yeah, take care of yourself. So, Gail doesn't seem to be Dr. Weir's biggest fan. Yeah, no, I don't think she is, but oh well. All right. You can't win them all. Post the local social security number, list Dr. Ed. I have mine for my city. All right. You were here yesterday, Scott. I had mentioned that if you Google local social security offices, sometimes they put down there the 800 number. And I have a list of an Excel spreadsheet of all of the local phone numbers of all the social security offices in the country. And I might just go ahead and I'll figure out a way to I'll get my son to figure out a way to put it under the community tab in YouTube or something like that, and that way you can look it up there. So yes, all right. So okay, I'll work on that one. All right, we're over an hour. Apologize for all the people I didn't get to your questions. I will be back again tomorrow, and I'll answer a bunch more and come up with the topic of the day and answer a bunch of questions. So y'all take care. Have a beautiful night, and please, please, please.